commend the mobilization of religious leaders to mobilize their adherents to accept vaccines, right? That is the most important thing, and I can see all across the land, and my colleague here also mentioned some states where governors have been up and doing, Lagos, in Ondo, Katsina, where you can see governors in Nasarawa state as well. You are seeing governors actually go out and talk to religious leaders to mobilize their followers to accept the vaccine. That is what we are applauding. I do not know the specific instances in states around compulsory vaccination. What I believe most of the governors are doing are providing an incentive for people to get vaccinated, right? People have a choice not to get vaccinated, right? But the environment that is being provided is what we've mentioned, that yes, you do have a right to say you don't want to get vaccinated, but you also do not have a right to infect others. There are conversations, for example, like if a health worker says they will not get vaccinated, that is fine and within their rights. However, is it also within their rights to infect their patients? Doesn't the patient have the right to say, health worker, I'd like you to get vaccinated and be protected against COVID-19 so you don't infect me, especially if that patient is immunocompromised. That is to say, the patient doesn't have an immune system that can fight the virus. So those are conversations that are going on in the States. And it is a healthy conversation that needs to go on in the States. And I don't think there should be any censorship of those types of conversations. The choice still remains with the individual. But as a society, we need to ask ourselves that question, whether after all of the investments by the federal government, by our donors, by our partners to procure the vaccines, so that we can protect ourselves, protect our elderly, protect the most vulnerable, that we should allow a few individuals, who have now delved into conspiracy theories, prevent us from protecting our loved ones, prevent us from building back better from a catastrophic situation that we faced because of the COVID-19 pandemic last year. Those are conversations that are going on in the States. It is part of democracy. It is what we should enjoy. We should not censor those debates. We should not be averse to those debates happening. But in the end, my belief is that reason will prevail and people will recognize the fact that these vaccines are safe, these vaccines are effective, and so people should be encouraged to come out en masse to get the vaccine. This is what most state governors are doing. They are mobilizing people to get the vaccines, albeit in some instances also putting conditions that will encourage people to now begin to think that it doesn't make any sense for you to be vaccine hesitant.
Vaccination, as you know, the primary endpoint were protection against severe disease, hospitalization, and death. And with that respect, all the vaccines listed for emergency use by WHO are effective. It's important not to differentiate that for just any occurrence of a new infection of COVID-19. The second consideration is consistency of finding. As we all know, scientific inquiry is about verification and falsification. Sometimes we have new information that contradicts previous information. Sometimes we have new information that confirm previous information. So the consistency of finding is very important. We cannot act on a single study because that will not give a sound basis for policy and its translation into practice. So we need to look at the whole body of evidence, and for the time being, it's just based on a quite limited observation. The third consideration, as I said, it's possible that some of the risk group could experience change in performance of the vaccine. So we need to identify those groups. Maybe they could be the target for consideration of potential booster doses. But I'd like to emphasize that we are not yet there. We advocate for all countries to reach at least 10% of the population in the vaccine by end of September, and hopefully by end of December to reach 40% of the population. So it's very important to understand that perspective. WHO has a whole committee, all group of experts who review the evidence on a daily basis. And this also clarified the issue of WHO position on the booster doses. We think it's only fueling vaccine injustice. And we need really to make sure that we exercise solidarity, because no one will be safe until everyone is safe. But let me emphasize, the vaccine is an additional tool. Fighting COVID-19 pandemic, it's not just with vaccine alone. It's vaccine plus other measures until certain that a sizable proportion of the population will be covered. The second question was about Sinopharm, particularly because in one country it was observed that after vaccinating 50% of the population, there was a surge in cases. I'd like to reiterate the same. The primary endpoint is protection against severe disease, hospitalization, and death. It was not occurrence of new infection. It's very important to understand that. And with that perspective, I think all the vaccines approved by WHO are effective. The decision to prioritize, as ED mentioned, belongs to the country. But from WHO perspective, all the vaccines that we have approved can be used for the sake of protecting population against COVID-19 vaccine.
That any of us would undertake, would always take people with disability into consideration. The HANDS program around prevention has people with disability and children with disability at its core, and it's an ongoing program, I think, in 7 states and across the country. So it does try to address not everything, but address the concerns that children would have should they be children with disabilities, or adults in that respect. And for adults, so anyone over 18, the fact that they have a disability should not prevent them from being vaccinated at all. So I think those are the 2 separate questions, but I've brought those together and hope it answers there. I think one of the unique elements, and this relates to, I think it's a colleague over here, on vaccines reaching out into the rural areas. The good part about phase 2 was a lot of social mobilization has taken place before, a lot of work with the traditional leaders, with the religious leaders, and looking at ensuring that there is a sense of mobilization, so people understand better what is available, where it is available, and how to take it, and why they should take it. So there's the fact that 60 to 70,000 people a day are being vaccinated using Moderna in itself is a success. Yes, we need to increase it up to 100,000, that's saying the target, but in itself, in the first week or so of this, it is a success in itself, but we need to take it up further. The rural areas are of concern, and adaptation to the rural areas will be made in due course, and the use of the different types of vaccine into the rural areas, so making it easier to administer the vaccines and make it less difficult, especially where the double vaccines are required. We might adapt it so that other types of vaccines could be used, but that's in the future. I think at the moment we need to focus on getting as many people vaccinated over the next 3 months and then into 2022 as is possible, and while at the same time trying to outreach into the rural areas with teams that are able to ensure that the right vaccine is used in those areas.